Hi, very good morning. I'm Dr. Janak Patel, MD, General Physician. All my video lectures are mainly for educative purpose. They will be very useful to fourth year students, exam going students for oral exams in your theory, as well as this will be also helpful to you in your everyday practice. Today I'm going to talk regarding a very short topic, that is divarication of recti. And there is two short video clips which shows you a very good divarication of recti. So we'll be talking on divarication of recti, or we call diastasis. So divarication of recti or diastasis. So you will be, while doing an inspection of abdominal examination, you will see there is a bulge in the center part of the abdomen. Here you can see there is a little bulge in the central part of abdomen, and particularly when the person raises his head, this is a classical divarication of recti. So divarication of recti or diastasis, it is a bulge of linea alba between the two recti muscle with their wide separation, and this will happen whenever there is a markedly raised intra-abdominal pressure, like ascites after multiple pregnancy, in obese person, and occasionally in a healthy individual due to separation of recti muscle, particularly in an old person. And whenever there is a divarication of recti along with midline scar, then we use the word incisional hernia. Now you can see here, when the person has raised the head, there is a bulge which is seen, prominent bulge which is seen in a midline, and this is described as a divarication of recti, or we use the word diastasis. So whenever you want to find out, it will be a separation of the two recti producing a bulge between the two recti, and that is called as a diastasis of recti. Similar finding you can get in an incisional hernia when there is a midline incision, or also you come across in an umbilical hernia, and also in a case of a direct inguinal hernia. So this will be few conditions which will produce distension or swelling when person raises the head. In a normal person, usually there is no separation of the two recti, hence there is no bulge between the two recti. Now you can see here there is a very nice bulge when the person is raising a head. You can see a very big bulge. This is due to divarication of recti, right from xiphisternum up to pubic symphysis. There is a very big bulge with little amount of umbilical hernia also. Now here also similar thing is seen, but you can see there is a scar. So this is secondary due to incisional hernia. This is not described as a divarication of recti. So difference between the two, if you look here, there is no scar seen, while here you can see a midline scar. So this is due to incisional hernia. Now we'll show you a demonstration of divarication of recti. This is without raising the head. There is a soft swelling in the center part, and you can see you can push entirely. Now when he's raising the head, you can see a nice bulge between the two recti. This is divarication of recti. Now we'll show you another one.
Have a silence.
Now here first I am demonstrating what we call as horseshoe shaped dullness.
This is all hyperresonance, right?
Now
always
this area will be tympanic, and as you go laterally, During percussion, you will demonstrate a dull
This
note.
is impaired.
Here there is a dull note.
Dull.
This is dull. Right? Now I'm going this direction.
Now, when you go to this side,
Now this is
now
impaired.
there is a dull note.
Dull.
This is dull. Right? પેલી બાજુ ફરો જરા.
Now, we are demonstrating shifting
You can see
dullness.
the dilated vein also.
Wait for a while and then you percuss again. Now this becomes resonant.
પાછા ફરી જાઓ આપણે ધીરે ધીરે.
And when you ask the person to turn back, wait for a while, now percuss, again it is a dull note. This is shifting dullness.
પરકસ કરો તો અહીંયા આગળ તમારે આટલા એરિયામાં આમ આ
So this is a horseshoe shaped dullness and shifting dullness demonstration on percussion.
shifting dullness. આવી ગયું બે વસ્તુ. બરાબર? હવે if I put my
Now,
ideally અહીંયા આગળ આમ
this
thumb
is
મૂકો અને કરી શકાય.
Fluid thrill.
also.
To
Exam
reduce the
exam માં અહીંયા હાથ મૂકો.
abdominal wall motion producing a thrill, you have to put the hand in the center part, percuss on the one side, and one person has to palpate on the opposite
પગ
side.
બેવ સિધા જ રહેવા દેજો. પગ બેવ સિધા
Now
જ રહેવા.
you are asking the person to raise the two lower limbs. You can see a very good divarication of recti in the center part
Clear cut.
with little amount of umbilical hernia.
સારું છે પહેલા કરતા. આવી જાઓ. આવી જાઓ.
Now you can see much better
Even you can see the hernia.
umbilical hernia also, and there is a divarication of recti.
ચાલો સારું છે. હવે મહિને જોઈશું આપણે.
So these are the few things which will be seen in
આ
a
બધામાં આરામ થશે. પણ
ascites.
બે વસ્તુમાં તમારે ઓપરેશન
So this was the demonstration for divarication of recti, or we call diastasis. So thank you for taking out time. I know that your time is valuable and I appreciate it for spending some of the time with me. See you in next lecture. This was a short clip showing you one finding, that is divarication of recti, and in a second video, horseshoe shaped dullness, shifting dullness and fluid thrill.